Therapy's Student and New Professional Subcommittee. My name is Nick. I will be your moderator this evening. Just a reminder that this is a live discussion, so anything that comes up, either comments or questions while we're talking, please feel free to comment either on our Facebook page or tweet at me. My Twitter handle is at NickCellSPT. That's also on our Facebook page, as well as using the hashtag PedsSNP. If you're going to comment on Twitter, that will also link you to this discussion. So, without further ado, we'll get into our topic tonight, which, in honor of Childhood Cancer Awareness Month, we will be focusing on pediatric oncology rehabilitation. The format for this discussion is a little bit different from our first few, in that we're going to focus tonight on impairment assessment and treatment of a population with pediatric oncology diagnoses. So why would we be talking about this in the first place? Well, one of the major reasons is that the survival rate for pediatric cancers is improving rapidly, and the latest numbers show anywhere between 75 and 80% survival rate for children with a diagnosis of cancer. So along with those increased survival rates come children who are living longer, living into adulthood, and who also are experiencing secondary impairments from their diagnosis and medical treatment as a result of their diagnosis of cancer. And so we'll go over some of the specific impairments tonight, but because of the longer lifespans of these children, we as PTs are being called on more and more to address the functional impairments that are related to, again, not only the medical treatments, but the prolonged hospitalizations, and then the cancer itself that these kids are experiencing. So what we will talk about first is some of the important questions that you might want to ask when evaluating a child with an oncology diagnosis. These are just some baseline questions in addition to your typical interview questions that you'd ask of any child or family. These are specifically for those with an oncology diagnosis. And so, the first question I have is simply, what are your concerns for your own child? So this is a great open-ended question that allows the parents, caregivers, and the child themselves to tell you what their biggest concerns are at the moment to help you direct your treatment. The next question that I have listed is, have you noticed any changes in your child since beginning treatment? So this is a great question to ask, especially if you do not have a baseline evaluation of the child. So if you have not met them before their diagnosis of cancer or before they've started receiving treatment, asking if there have been any changes since beginning treatment can be a great way to direct your interventions. And so to be more specific, you can ask about gross motor skills, gait. There's some common gait impairments in those undergoing cancer treatment, which we'll talk about. Functional activities, so running, jumping, hopping, skipping, and we'll go into more detail later on those as well. And also just endurance and activity tolerance. So because of the, again, prolonged hospitalizations that can be a result of cancer treatment, the treatment themselves, such as chemotherapy, radiation, these can have effects on endurance and conditioning, and so that might be a way to address this. And then finally, the third question I have, and please feel free to send in more questions if you have them related to pediatric oncology that would be pertinent to this population. But what I had down is to ask where they are specifically in their treatment cycle. So children may present differently depending on the phase of treatment that they're in, whether that be the induction phase, so kind of the initial treatment phase, the delayed intensification, which is later. Often children will look kind of their worst during this time just because of the volume and intensity of treatments, medical treatments that they're undergoing for their cancer. Are they in the maintenance phase, post-treatments, etc.? So it's really important to know where kids are at in terms of their treatment protocols so that you can kind of have an understanding or an expectation for how are they going to look now compared to later down the road or compared to before when I saw them in their initial phase of treatment, etc. So if we do not have any comments or questions regarding the subjective portion of a evaluation for a child with a cancer diagnosis, we will move on to some of the common impairments that you might want to look for during an assessment of a child with a cancer diagnosis. So the first one I have listed is peripheral neuropathy, and this is basically sensation changes, usually in the distal extremities, so hands and feet, in children undergoing chemotherapy, and specifically a type of drug called vincristine. This is common in children who are undergoing treatment with that drug. So checking sensation, especially in the distal extremities, is key with this population. To go along with that, decreased range of motion is another common impairment, particularly in ankle dorsiflexion. So if we think about, again, peripheral neuropathy affecting the distal extremities, ankle dorsiflexion range of motion tends to be affected both passively and actively. A side note, if you do see a loss of hip rotation range of motion in a child undergoing cancer treatment, this should raise a red flag for you in that you should be considering the possibility that this child has something called osteonecrosis, which is basically the dying back of bone, and this would be in the hip joint, usually the femur, the proximal femur. So that may be an indication to you to refer this child on or to consult with a medical professional to get some imaging done. Again, if you see a significant loss of hip rotation range of motion in a child with a cancer diagnosis. The next common impairment is muscle weakness. So this can be tested through manual muscle testing, although you may want to consider the child's age. Children under 5 can be difficult to get a reliable manual muscle test with, and so other ways to look at strength in a younger population, as well as an older population too, is to look at functional strength. So how are they transitioning? How are they doing common gross motor activities such as supine to sit or floor to stand, squat to stand? Looking at those transitions can tell you a lot about a child's strength without having to do a formal manual muscle test if that is not feasible. Some specific things that you want to remember about strength testing: for sure, look at all major muscle groups, but be extra sure to look at ankle dorsiflexion and great toe extension strength. Again, going back to a common impairment of peripheral neuropathy, if we have sensation changes, we may also have motor changes in the distal extremities. So looking at ankle dorsiflexion, great toe extension specifically is going to be key for this population. Another common impairment to look for is decreased balance. So if we think about sensation changes, especially in the feet and the toes, these are important during gait and really any balance activity. So if a child has deficits here, their overall balance, both statically and dynamically, may be decreased. Also consider muscle weakness could play a factor in this. And there has even been reports of vestibular impairments as a result of certain types of drugs used in cancer treatments. So consider the treatment undergoing, or the treatment that the child is undergoing, and the specific drugs that they are taking during treatment in terms of looking at their balance. The next impairment I have listed is changes in gait. And so we think about, again, if we have weakness or sensation changes in our distal extremities, we may be looking at things such as foot slap. If we think about decreased range of motion, especially in our ankle dorsiflexors, we may see a decreased heel strike, toe walking, similar impairments during the gait cycle. Another side note, if you're noticing a Trendelenburg gait, or that kind of lateral lurch to a child's gait while they're ambulating, again, this should raise a red flag if this indicates hip rotator weakness and possible osteonecrosis. It may be indicated to refer this child on to get more of a medical workup and imaging done. That's, again, if you're noticing hip rotator weakness. The next common impairment I have listed is decreased endurance or deconditioning. If we think about the medical treatments that these children are undergoing, as well as the prolonged hospitalizations that many of them may be experiencing, this puts them at high risk for deconditioning, decreased endurance, and so this may present as decreased activity tolerance, even things like changes in a child's posture. So if they're demonstrating core weakness, changes in their foot posture, these may be signs of some deconditioning going on as well. And this is also, again, where your subjective interview becomes very important. It's important to ask the child and the family whether their activity tolerance is similar or decreased compared to pre-treatment levels if you haven't gotten a baseline on this child before. And finally, the final most common impairment that I have listed is gross motor skill deficits. If we think about this, children are developing rapidly, and a diagnosis of cancer plus the resulting treatment can really disrupt this growth period and can alter the trajectory of children who may have even before been typically developing and met their motor milestones on time. Cancer treatment and a diagnosis of cancer can interrupt this period of growth, and so we have to consider looking at children's gross motor skills, making sure that these do not regress, and if they do regress, addressing this in our treatment interventions. And we'll talk more about that next in our treatment ideas section. Just looking to see if we have any comments or questions, and if not, we will move on to our treatment ideas. So the list that I have put together, number one is to consider orthotics. So if we think about all the impairments that we just talked about, the sensation, muscle weakness, foot posture, gait impairments, balance impairments, all of the above, gross motor skill deficits, orthotics may be indicated for this population to assist with gait training. It may be indicated for range of motion deficits. It depends on the child, so you need to do a thorough assessment and evaluation to determine if they do have gait deficits or range of motion deficits or gross motor skill deficits. Why? Is it changes in sensation? Is it balance issues? Is it muscle weakness? And then depending on those, decide what type of orthotic, if any, would be indicated. So a solid orthotic, hinged orthotic, depends on the child and their impairments. The next idea, gait interventions. So we talked about possible gait deficits. Some ideas that you can use with kids undergoing cancer treatment. However you want to term heel walking. Some children understand the term heel walking. Some will do better with a demonstration. I've heard the terms duck walking, penguin walking, anything that would basically get a child to walk on their heels and get their toes up into a dorsiflex position as they walk. This works on dorsiflexor strength, works on their balance, and hopes to combat some of those common deficits that we see in children with cancer. Another idea for gait interventions could be treadmill training, so retraining that gait pattern, hopefully in a more controlled and biomechanically correct manner on the treadmill, can be indicated for this population. Another treatment idea to address postural deficits, if you find these in a child with cancer. So if we think about core strength, using a therapy ball, V-ups, so prone extension. You can do this on the floor while playing a game. You can do this on a scooter that wheels around the clinic. Basically any way that you can make this fun. Sit-ups you can do on the floor, on a therapy ball, depending on the child's ability. So those are some ideas for core strengthening. If we have hip and lower extremity weakness, we have ideas to work on those too. You can use functional movements like squatting. You can use things like monster walks, so sideways stepping with or without a TheraBand for hip rotator strengthening. But basically some interventions to help with the postural deficits that may come along with a child who's undergoing treatment for cancer. Next treatment ideas focus on muscle weakness. And so what I have listed here is just to focus on function. So to get the most kind of bang for your buck in terms of muscle strength, we want to think about things that kids will do throughout their day that we can help them with. So think about transitions like floor to stand, squat to stand. If it's a younger child, supine to sitting, sitting to 4-point. And that goes along with, other gross motor skills such as hopping, stair navigation, jumping, etc. Another idea for muscle weakness, particularly if the child has peripheral neuropathy, is to work on foot intrinsic muscle strengthening, especially if the foot posture concerns are due to weakness in the foot muscle. So you can think about foot caves, where the child will basically create the arch with their foot, emphasizing less of that pronated posture and more of a neutral position. You can do things like picking up marbles with your feet and putting them into a bucket. Anything to get those small muscles of the foot working and activated is a great idea to consider for this population. In terms of balance interventions, some ideas, single leg stance. So this can be with eyes open or eyes closed, depending on the child's ability and safety considerations. Think about working on more compliant surfaces. So if you have a foam pad or a mat, a BOSU ball, a tilt board, any of those ideas can be great for this population. Balance beams, so working on staggered stance or tandem walking, can be very good not only for overall balance, but also if we think about gait deficits. So if we're seeing something like a wide base of support in a child, or perhaps a child with a cerebellar tumor, I think about the coordination deficits, and maybe we want to work on narrowing that base of support. Something like a balance beam, or even a roll of tape laid out on the floor for the child as a less expensive option can be very good. Next idea, to address motor skill deficits. So the first thing I had listed here is to use an outcome measure whenever possible. So this can be something like a Peabody, which has a balance scale. It can be the BOT. It just depends on the child's age and what you're looking at. But some gross motor skills to consider. Again, think about transitions for younger children, supine to sit, even rolling from supine to sideline, to and from prone, half kneel to stand, squat to stand, floor to stand, any of these type of transitions, consider looking at and addressing in your interventions. Other gross motor skills to consider for children: stairs. So by age 4, children should be expected to go up and down stairs reciprocally without using external support. So we want to keep that milestone in mind and consider stairs as a functional task for most kids. Other gross motor skills to address: hopping, jumping, running, skipping, galloping. All of these depend on the child's age and their own development, but they're things that we want to be thinking about. We don't want to forget about motor milestones and gross motor skill progressions, even in a child with cancer, because this is going to be especially important for this population as they move forward, because again, their development has been disrupted by this disease process and the subsequent treatment. And then finally, to address the common impairment of deconditioning or decreased activity tolerance, an outcome measure that you might want to use is something like a 6-minute walk test, great test of endurance. Knowing the guidelines from the American Academy of Sports Medicine, American College of Sports Medicine. So that's 60 minutes a day for children. So educating caregivers and children on this recommendation and the fact that just because we're going through treatment for cancer doesn't mean that we don't need to still strive to meet these guidelines. It may be working up toward that as a goal, but it doesn't mean that we don't still use these norms for children. Again, in the clinic, an idea to work on deconditioning is treadmill training. It's a very controlled way to monitor and progress children in their walking endurance. And then especially important is to have kids on a home program for activity tolerance and endurance. So even something as simple as a home walking program that the family can do with the child or the child can perform by themselves, whether they're in the hospital or staying at home, is going to be key to maintaining their endurance and activity levels both during and after treatment. Okay, so that is what I have for this evening. Some resources for those interested in learning more about pediatric oncology rehabilitation. This is a rapidly growing area of physical therapy and pediatric PT in particular. So I encourage you to look at the following resources, as well as contact us if you have any further interest in this area of physical therapy. The first resource I have listed comes from Children's Hospitals and Clinics of Minnesota. They have an extensive pediatric oncology rehabilitation program at within their hospital system. So we'll post these resources on our Facebook page, but I encourage you to check out Children's of Minnesota and their pediatric oncology rehab program. The next resource I have listed is from the APTA. Specifically, the oncology section has a pediatric oncology special interest group. And so if you are interested in learning more and connecting with professionals in this area, I would strongly encourage you to join this special interest group, or at least find out more information about it if you are interested in this population. And then finally, the third resource I have listed is the Children's Oncology Group. You can just search Children's Oncology Group on Google, or again, follow the link that we'll post on our Facebook page. But this organization is involved in determining and setting the treatment protocols for children undergoing cancer treatment. So when you hear children are in different phase trials, so there's phase 1, 2, 3, and 4 of cancer treatment, and this group, the Children's Oncology Group, are the ones who are basically setting these protocols and distributing them to major pediatric cancer treatment centers across the nation. So a great resource also to check out. So if we do not have any further questions or comments, we will end this discussion. Thank you for tuning in, and we hope to see you next month.